Good afternoon, ladies and gentlemen. I'm very happy to be here to share about lupus with you. I'm quite sure not many of you knows what lupus is. Can I have a show of hands? Who's heard of lupus or knows someone who has lupus? Okay, yes. Just as I guessed, not many. Okay, I shall start. What is lupus? Lupus is sometimes known as the disease of 1,000 faces. It is actually short for systemic lupus erythematosus, or SLE. It is an autoimmune disease whereby the body's immune system attacks the body's own healthy tissues and organs, causing pain, swelling, inflammation. And it can affect any part of the body, including joints, skin, kidneys, blood cells, brain, heart, lungs, liver, etc. Where there is a major organ involvement, it can become life-threatening if the condition is not well controlled. It is chronic in nature and there is no known cure. And it affects women more than men, the ratio being 9:1. Most often being diagnosed between the ages of 15 and 45 for women, that's the childbearing age. And it is more common in African Americans, Hispanics, and Asians. The exact cause of lupus is still unknown, although some potential triggers have been identified, like sunlight. Exposure to the sun may bring on skin lesions or trigger an internal response in susceptible people. Infections. Having an infection can initiate lupus or cause a relapse in some people. We call that a lupus flare. Medications. Lupus can be triggered by certain medications. People who have drug-induced lupus usually see their symptoms go away when they stop taking the medication. Okay, symptoms of SLE are plenty. The butterfly rash across cheeks and bridge of the nose. It is not present in every patient. I can say most of them. Okay, fatigue, it can get extreme when the disease is active. And then of course you have the low-grade fever, joint pain, stiffness, swelling, shortness of breath, chest pain, pleurisy, headaches, confusion, memory loss. We call that sometimes the lupus fog. Mouth ulcers, weight loss, hair loss, skin lesions with sun exposure, also called photosensitivity, Raynaud's phenomenon, where the fingers and toes turn white or blue when exposed to cold. Treatment for lupus depends on the signs and symptoms and the manifestations in different persons. The medications most commonly used to control lupus include non-steroidal anti-inflammatory drugs, NSAIDs, anti-malaria drugs like Plaquenil, corticosteroids like prednisolone, and immunosuppressants like azathioprine. And now I come to my journey with lupus. My first experience with lupus was way before I was diagnosed with SLE. My late eldest sister had succumbed to the complications of lupus at a relatively young age of 44. She had lupus for 10 years and was considered by her doctor as being lucky to have lived the full lifespan of a lupus patient then, which was 6 to 10 years at that time. And that was during the 1980s. At that time, the illness was not well understood as disease information and awareness were low. Patients themselves found difficulty in explaining their affliction to people around them, be it their family, friends, colleagues, relatives, or employers. And they were often misunderstood as whiners or being lazy because of the fatigue, or they are skivers at work. And my sister was one of them. She told the family she doesn't know what sort of sickness she was having. 不知道是什么鬼病啦. That's what she said. She was in and out of the hospital 4 or 5 times a year, each time staying at least a month or more, and was always on high doses of steroids. Steroids are both a foe and a friend to lupus patients. It is a friend due to its effectiveness in controlling lupus symptoms, but a foe because the side effects are extremely damaging with long-term use. It was hard for my sister to keep a regular job, let alone take care of her 4 young children. And of course, through the 10 years, her family became financially drained by the medical expenses. I was diagnosed with lupus nephritis in the year 2000. The many symptoms I was experiencing over many years, like migraines, joint pains, chest tightness, insomnia, were invariably diagnosed as symptoms of stress and anxiety by the GPs that I visited. I did not have the infamous butterfly rash on my cheeks, and I generally looked well perhaps due to my grooming. But it came a time when I began to suffer severe migraines on a daily basis, debilitating painful joints, widespread muscle weakness, sudden weight loss, and extreme fatigue. By then, painkillers did not work anymore. The frightening thought that I might not be able to see my children grow up came to my mind. I decided to go for a full medical checkup. After the test results were out, I was immediately referred to a rheumatologist and warded for aggressive treatments. My kidneys were by then in a severe stage of dysfunction, having been attacked by lupus. The diagnosis had felt like a death sentence to me because I've watched my sister and what she went through. The thought that I had been diagnosed rather late after having the symptoms for such a long time, it worried me, and I began to fear that I had little time left. However, the doctors assured me that with medical advances, there were much better drugs and treatments available at that time, by then. So based on their assurance, I tried hard to stay positive, though my mood was low. Unfortunately, hormonal change brought forth by the strong and aggressive treatments and the side effects of the immunosuppressants and the chemo drugs used in the treatments exacerbated my low moods, and I soon lapsed into depression. I was tearful and crying all day long, and my loved ones were tearing alongside me. Even in the midst of my despair, I could see how painful it was for my family. And I felt heartbroken to see them being so distressed. So the love from my family motivated me to fight the depression. I was intent on not causing them any further pain, and I finally overcame the depression within a relatively short grieving period. This was me with my moon face. And then that's my family at that time. Okay. After many months when my lupus symptoms were less severe, I was somewhat ready to face the world again. I had been quite homebound during the treatments, staying away from crowded places, afraid of catching an infection. And of course, there were no movie theaters, shopping centers, or even eating out much. I had by then gained a lot of weight from taking steroids and had a full moon face, a side effect from steroids use. With the migraines and the aches and pains having eased, I was feeling much better than I did for many years. Other than taking the medications, I knew I needed to start taking charge of my own health. So I had begun reading all about lupus from books, from the internet, the pamphlets, from the time I was diagnosed, and I learned quite a lot. I was very clear on the triggers to avoid, because you have to take care of yourself. So I took adequate rest, I ate healthily. I was mindful of the importance of avoiding stress and keeping a cheerful disposition. Having been through the fear of feeling that I had little time left on the earth taught me to appreciate and treasure my life. I learned not to take things for granted, nor waste time on negativities. Over time, I started doing yoga and swimming, and I found regular exercise most uplifting. Slowly, as I grew stronger, I felt it was time for me to meet others with the same illness. Lupus is not a commonly known disease, and not many people have heard of lupus. In fact, at that time, none of my friends knew anyone who had lupus. Naturally, I was looking forward to meeting people who has their experience with lupus to share with me. So I contacted the Lupus Association Singapore. I first heard of Lupus Association early in the year 1992. LAS, or short for Lupus Association Singapore, sent a wreath when my sister passed away. So after having watched my sister suffer through her illness, mostly alone for so many years, I remember thinking to myself that it was timely to have a support group. Lupus Association was registered in 1991 to support patients and their caregivers, to raise public awareness on lupus, to promote research on the disease, and to educate and empower patients. And we do that through educational talks 4 times a year, lupus-related topics, and we print 3 newsletters a year, and we have various social activities. It is a patient-led support group, fully run by volunteers, and we received charitable status in 1992. LAS also has a medical subsidy scheme where we subsidize the drugs and treatments of low-income patients. At the association, I met many other moon faces like what I was at that time, and became less conscious of my own. The volunteers were warm and welcoming, and they knew the illness well, and that was so important for me because I learned from them. We were like sisters in arms because most of us were females, fighting a common enemy. I was very comfortable mingling with them, so impressed with the good work of the association, I became a volunteer when I felt I was physically ready, and that was after a few years. Yes, my recovery did take that long. Having personally benefited from the support of the volunteers, I felt the need to give back and to help other patients. It wasn't just a need, I really felt the importance as well. The LAS volunteers are also known as the Lupus Support Group in Tock Seng Hospital. We visit patients at Tock Seng on a weekly basis, and we still do that now. In the past, a large concentration of lupus patients were at Tock Seng, as it had the only rheumatology clinic in Singapore. As such, we have always worked very closely with Tock Seng. Today, we have rheumatology clinics in most of the government and restructured hospitals, and patient visits are also conducted at the other hospitals. So as you can see from the slides, lupus actually made me strong. Okay, my self-empowerment, learning all I could about SLE, it came in handy as a volunteer. To be able to share with fellow patients, volunteers need to equip themselves with adequate, accurate knowledge. You have to learn before you can share. Therefore, it is a process of empowering oneself before you can empower others. Volunteering and sharing opened a whole new path for me, sharing my knowledge and experience with fellow patients, helping to ease the concerns, the worries, the anxieties, especially when they are newly diagnosed, and helping patients gain confidence and coping skills so that they can move forward in spite of lupus. In 2009, I was initiated into the Elias Council as the honorary treasurer, and in 2011, I was elected as the president of the association. Admittedly, I was a little reluctant at first, as I considered myself lacking in leadership position. But the important role of the association, the important work it is doing, and the many patients looking for support from the association changed my mind, because we have a membership of about 500. After more than 6 years leading the group, I found it to be a most meaningful and rewarding role. So here we have some sound bites from the doctors and the patients. Associate Professor Leong Kai Pang from RAI, Tan Tock Seng Hospital, said, "The Lupus Association is a great blessing to patients suffering from lupus. Through the association, patients can find support, consolation, coping skills, friendship, and even financial aid. One of his patients, Li Zhen, has gone through a lot of suffering due to her illness. The association helped her not only financially, but more importantly, in giving her emotional strength." Thank you, Elias. So this is a motivation for me as well. Okay, Associate Professor Leong Keng Hong said, "When doctors tell patients that the side effects of medicines like steroids will slowly go away when the dose is lowered, they won't usually believe us or believe the doctors. So when we tell them not to seek all sorts of other treatments, they also won't believe us. But when a fellow patient tells them these things, they will believe. The support group is very helpful in helping our patients stay healthy by taking their medicines properly, because we are living proof, you know." Okay. Lupus patient Harish, he's here today. One of the few male patients we have in the association. The hardest thing a new lupus patient goes through is the unpredictable situation. In that, I mean not knowing when he or she is going to have a lupus flare. That's been one of the hardest things to deal with, in my opinion. LAS Volunteers does a great job in guiding lupus patients, especially new ones, so that he or she will feel comfortable in their journey with lupus. Thank you. See, in lupus, it being a chronic illness, and on top of that, we will experience flares every now and then. So it's very unpredictable, and we need a lot of support, especially when the illness is active. Okay, so Jasmine Peng, a lupus patient, she's now warded in the hospital, so she's not here today. Lupus has evolved under Irene's leadership plus mentorship over the years to represent a new phase of lupus. Lupus is now no longer deemed as a terminal disease with poor prognosis. It is now a chronic disease with excellent prognosis in that patients can lead normal lives, get an education, hold jobs, marry, and have kids. Irene's dedication to the association and patients are commendable and is very much appreciated by patients and members. And this view is shared by many patients. Well, I am embarrassed to read that actually, but this is what she wrote. So. Okay. Okay, just to show you some of the activities we do. Here are some pictures. Up there in the middle, we have our 25th anniversary celebration last year. And then we've had actually Walk for Lupus twice, once in 2014, once in 2016. And we've got exhibitions, we've held exhibitions, and there's a picture of our empowerment talk. And we also have exchange programs with foreign groups. Handicraft making. We have also our own fundraising. We have bonding trips, patient visits, Saturday morning walks, and we also have an activity for those who are working. So we have a Elias Social Friday every last Friday of the month so that those who are working can join us. Our association celebrated our 25th anniversary last year with festivities which included a celebration party, a public forum, Walk for Lupus 2016, and the launching of our commemorative book on Wings of Love, which documents our association's history, but most importantly signifies the resilience of lupus patients. Through the years, Elias has been supporting, educating, and helping SLE patients, and we hope that through greater awareness of the disease, it will be easier for our patients to live as normally as they can. Finally, I want to say that we, lupus patients, we struggle with lupus symptoms on a daily basis. Even when our condition is in remission, we still experience in varying degrees the fatigue, the joint pains, the migraines, insomnia, etc. And there's always the constant mindfulness, or you could call it the fear at the back of your mind, that the disease might flare up anytime, especially where there is a major organ involvement. Yet we bravely soldier on each and every day. I am very proud of lupus patients in general, and I salute our volunteers for being resilient in the face of adversity and tribulations, and yet able to find the strength to extend themselves to help others. I hope I gave you a good idea of what lupus is today. Thank you very much.
Well, let me just, share. Thank you for sharing, your journey with us. It's very insightful for us to see someone who was a patient who became a volunteer and now a patient leader as well. Do we have any questions from the floor? For Irene. Well, I do have one question. It seems as though, as you mentioned, lupus is a disease with 1,000 phases. So if we have a family member, we are not sure whether they have lupus or they have lupus, how then can we help them?
Okay, because lupus symptoms are so unlike many other conditions, so you will test for lupus. If the doctor feels that you should test for lupus, then you will have to go through the blood test, usually the double-stranded DNA. Yeah, that would indicate.
But even that, because many a time, like fatigue, it sounds like it can be anything, like yourself, when you suffer from fatigue. Mm-hmm. So do we look at multiple symptoms?
Yes. Mm-hmm. The doctor should be able to tell.
So that means the suggestion then is, if you have a family member who seem to be suffering from, a variety of symptoms that you that you showed us earlier, do suggest them to go to doctors.
Yes, I think when they see doctors, the doctors will know when they need to be tested for lupus. Yes.
And can you share with us, if any of us down here would like to get involved in LAS, what are some of the things that we can do?
Okay, you can contact our office. Actually, I think I skipped one. Yeah.
There we have it.
Yeah, contact information for Lupus Association. Okay, you can get in touch with us because we are fully led by volunteers, including the doctors that are on our council. We have doctors from the various hospitals. Yes.
All right, thank you very much. Once again, thank you, Irene, for sharing your story.
Thank you.